Go.
This is a good position that I work on with patients that have any kind of asymmetry side to side, to work on lengthening that side with a little bit of muscle control. So if I have someone, for instance, that has a pelvis that shifts one way, right? And this could be with or without some type of scoliosis. So if my hip kicks to my left, I'm putting more weight on my right leg. And part of this is I want to get that pelvis underneath their trunk, and I want to get their upper torso up over that pelvis to be more square, right? Typically this is going to be a weaker leg that I want to work on getting weight down into. So if I'm at a stair or this chair, right, I'm going to have that side where the pelvis was kicked out, right? I'm going to have that leg on the ground. And I'm going to take the post up in front, so on a staircase. Now it's nice if they have a railing to put this arm up on. Sometimes I'll even have them use two posts, but if they have a railing typically on the right side, that works well. Now my hand's going to be relatively high on the post, and I'm just going to let my front knee bend as I push that post forward. Now with this post, I tend to try and get it a little bit out to the side because I want to encourage them to keep the weight over towards that side where that leg is on the floor. I don't want them to start leaning away like this. So I'm just going to let my front knee bend as this post pulls me up tall. If anything, I want to feel like I'm putting a little bit of pressure down into this post, which keeps my weight more on this side. And then I'll come back out of it. One thing I'm looking for is I'm behind someone, and this may not be perfect because I don't have any significant shift in my pelvis. Let me head over there so you can see me. Is that when I stand behind someone, typically I'll see this little kick one way or the other, right? And I want to see that whatever foot I put up on that chair, up on like second or third step, I want to see that that kick corrects itself. So if I have someone who's here, right, I want to see that when they put that foot up on the chair, it kind of pulls their pelvis underneath them. And that's the side I want to focus on. So that's where I'm going to have them focusing on that side, coming through, pressing down into that post, really focusing on the weight bearing through that left side while I'm lengthening it. Because if my pelvis is kicked out to the left, especially if there's a scoliosis component, typically I'm going to be collapsed on that side. So as I bring myself into this centered position, right, I don't want to bring myself over and down. I want to bring myself over and up, which is what that post kind of supplies me with. So I could do that at a stair like I just did.